fundamentally and most simply what it was a ruse by the manufacturers and then the distributors to convince medical providers and then patients that, number one, these were not addictive, that they had broken the code of opioids and somehow created a non-addictive opioid, which was never the case. The opioid epidemic makes national news all the time, and it was a national crisis, but it was really felt locally the most. Our counties bore the brunt of the expenses of this over the last couple of decades because they're the ones that had to house the folks that were affected by it, or actually take care of the families that were affected by it. Indigent health care, kids that were displaced, jail populations exploding, and medical care that they would end up having to pay because of housing those inmates who would be opioid addicts. It was horrific, and it was felt year after year by these counties, eating into their limited budgets and finances. So this was an opportunity to try to recoup some of that through this litigation and now through these settlements. It's absolutely harder on the rural counties, and that's what people don't understand because they have very, very limited resources. And they are already, those resources are already taxed. They're already spoken for. There's not room in these budgets to deal with this ongoing and increasing problem over the years. And so, again, what would happen is they would have to pull from other needed resources, from infrastructure, or from education, or from hospital, just redistributing medical care from taking care of kids to now taking care of opioid addicts and those sort of things. And so it really hit them extremely hard, and it was kind of the silent part of this that we were trying to shine a light on and try to hold those responsible to make them pay for what they did. They funded studies and all kinds of propaganda to convince good providers and the medical industry that these were now safe, and they were never safe. And what it did then was propagate massive amounts of opioids, mostly in the form of pills, that were distributed across the country, and again then created addicts. And it doesn't take long for someone to become an addict. Again, someone who would never have been addicted or didn't have a propensity to become addicted to anything. Then you've got synthetic opioids that were developed that were 10, 20, 100 times stronger, and it's the current problem we have with the fentanyl and that sort of thing. So that's in a nutshell what the problem was and what needed to be addressed. When the opportunity presented itself, we knew this was a very righteous piece of litigation that needed to be done. And it's hard fought, a lot more so than people would think. The litigation is ongoing. We still have cases against defendants that will continue to pursue, holding everyone accountable for this tragedy.